As local COVID-19 cases continue to skyrocket, with Guyana currently recording 709 confirmed cases, the search to identify the ingredients of a successful national response has intensified, with one of the very necessary options being to decentralize more COVID-19 resources across the length and breadth of Guyana. This is according to Deputy Chief Medical Officer Dr. Karen Gordon-Boyle, who noted that the relatively low number of cases being recorded in regions 3, 5, and 6 is a reflection of the fact that insufficient testing is being done there. She spoke to the need for improved testing in those areas. During a Zoom interview with this newscast on Tuesday, Dr. Gordon Boyle explained that the best way to do that would involve health authorities in every region actively going out and testing persons who are fearful of the virus, were exposed to an infected person, or who visited high-risk areas. She opined that at least 300 tests should be done daily countrywide to get a picture of the true incidence of the disease.
In some regions, not at all enough. So we got a lot more testing to do. We need to try and reach like a level of like 300 tests a day before we're going to really be saying something that the numbers are the true numbers.
She stated that while an increased number of samples are being taken, the testing capacity at a laboratory is still limited. In response, the Health Ministry is undertaking the training of 56 persons in PCR testing to develop a 24-hour testing system.
Have people on schedule, so you'll have maybe 3 different sets of persons able to work within a 24-hour period, and so you can have continuous testing done. When we get to that point, which I think we will be ready within another week to start that, or maybe 2 weeks, then you'll be able to really, the laboratory will be able to match in terms of their testing capacity with the amount of samples that coming in.
This comes in the wake of regional health officers and other officials in regions 1 and 9 pleading for resources to be shifted to their regions to assist in their COVID-19 response. Additionally, newly appointed Minister of Health Dr. Frank Anthony at the swearing-in ceremony of cabinet ministers on August 5 also weighed in on the need for COVID-19 resources to be appropriately apportioned to the regions to curb the spike in cases.
So what we have for the interior area, the turnaround time to know whether somebody is positive is sometimes a week to 9 days. And that is certainly in this pandemic, that is absolutely not good enough.
For the HGP Nightly News, Amel Griffith.